Hi there, my name is Dr. Andrea Reh and I'm a physician at Shady Fertility. Thank you for taking the time to watch our video today. We're going to be talking a little bit more about endometriosis, particularly in light of Lena Dunham's recent press about her struggles with endometriosis, which is bringing this again to the spotlight. So I think when we look at options for treatment, we look at whether someone has pain or whether or not they're trying to conceive. So I'm going to try to talk about that in light of those factors. So let's say you have pain with endometriosis, but you're not trying to conceive. Well, generally in those cases we'd focus on hormonal medications to alleviate the pain, or even having surgery. When it comes to having surgery, our goal really would be just to have that surgery done once, and ideally in the hands of an experienced surgeon, particularly someone skilled at laparoscopy. After that point, if you're not trying to conceive, women do have options now to preserve their fertility for the future. And we are seeing that women with endometriosis are choosing to freeze their eggs because we do know that endometriosis can get worse over time, unfortunately. And we all know that a woman's egg number for all women is going to decrease over time. So we're seeing that more women are choosing this procedure just in the event that their endometriosis may threaten their fertility in the future. But this is an individual discussion that we would want you to have with your fertility specialist too. Okay, so let's say that you have pain, but now you do want to try to conceive. Well, for a lot of women, this creates kind of a catch-22 because you have to come off of the hormonal medication, which is suppressing ovulation, but then when you do, you have pain. And if you have your period at the end of the month, not only are you frustrated that you didn't get pregnant, but you're having a lot of discomfort. So sometimes in this case we'd recommend a fertility evaluation primarily in the interest of expediting your treatment and expediting pregnancy. Sometimes this will mean that we recommend surgery, which can sometimes buy us a window of time in which you will be pain-free. Other times we'll recommend just proceeding straight to fertility treatment, such as medication with IUI or IVF as well. We know that these are very effective at increasing the chances that a woman will conceive. So if you've already had surgery once, the question may be, should you have it again? And that's where the recommendations are a little more in favor of avoiding future surgery. The reason is that while it's tempting to go and remove every cyst of endometriosis that it forms, every time we do operate on a woman's ovary, we do unfortunately lose healthy eggs. So, and also we've seen that studies have shown that this type of repeated surgery does not increase the chances of pregnancy after fertility treatment. Okay, so let's say that you don't have pain and you're trying to conceive. So for women that know that they have endometriosis but don't have any pain from it, again, the options are going to be individualized. The benefit of surgery in these cases is much less clear. Again, we don't necessarily want to cut away good, healthy ovarian tissue. We do know that medication with IUI or IVF can be very effective in these cases. And this is again something that we would individualize based on your age and your treatment history together with your fertility specialist. So in summary, endometriosis can present in a number of different ways, but there are a lot of treatment options. So as we're seeing more people present with this condition, hopefully women will feel empowered to their treatment options that they have. So my name is Dr. Andrea Reh, and I want to thank you for taking the time to watching this video. And if you have other questions, feel free to look at our website at www.shadygrovefertility.com.